Chair, and thank you for joining us again today, Minister. It's been a very busy time for you and the health officials that are here today, particularly Dr. Tam. I really appreciate you virtually stopping by York Region recently and for joining us the second time here in committee. I'm thrilled to have this opportunity to ask you the questions that I consider to be important to my constituents. Minister, we're all aware of the heavy toll that COVID-19 pandemic has had on Canadians and especially on their mental health. I'm seriously concerned about this, which is why I introduced a motion for us to study the impacts of COVID-19 on mental health of Canadians. These are uncertain times, and there's no doubt that many Canadians are facing new and increased concerns with their mental health. Could you please explain to the committee what your department is doing to help Canadians access mental health services?
Well, thank you so much through the chair, and thank you for the focus to the member on mental health and people who use substances. You know, we know that this pandemic is creating a high degree of anxiety, of loneliness, of stress, of grief, actually, for Canadians as they work through the many aspects of living through a pandemic. And in fact, early on, drawing from experiences of countries that were ahead of us, we knew that we needed to rapidly act to put together supports for Canadians, no matter where they lived, no matter what supports they already had in place, because of course so many Canadians don't have access to mental health services or substance use services where they live. And that's why this spring we launched the Wellness Together portal. It's completely free, it's completely confidential, it's available in both official languages. In fact, there's translation for folks that don't speak either official language. And as of November 17th, more than 613,000 Canadians across the country have used this portal with over 1.7 million distinct web sessions. The neat thing about the portal is it actually connects people to professionals, as well as providing some, self-assessments and self-help tools. But people can actually get help from professionals through texting, through telephone, through virtual visits. And I know there's more to do, but this was certainly something that I think can help support people, especially folks that don't have access or trusted providers in other parts of their life.
Thank you, Minister. There's no doubt that COVID-19 has changed our lives. It's increasingly apparent that some groups are feeling mental health impacts of COVID-19 much harder than others. There's also an increased awareness of the need to address inequities amongst Canadians. And it's my understanding that you've announced a fund specific to addressing mental health amongst Black Canadians and other racialized groups. Could you please elaborate on that?
You're absolutely, Mr. Chair, through the chair, the member's absolutely right. The impact of the pandemic, although we're all in it together, has different factors for different groups. And one of the things that we have seen, of course, is the experience of anti-Black racism that many people from the community have spoken about, not just during the context of the pandemic, clearly, but as part of their everyday experience. And that groups that are racialized, that are stigmatized as a result of their backgrounds and their experiences, it really is, it is a public health threat. And that's why we're investing $10 million through the Mental Health of Black Canadians Fund. This project, this funding will support 16 community-based projects across the country, doing very important work to support Black Canadians in these challenging times. We've also extended applications specifically for projects to support Black LGBTQ2+ Canadians. Another gap, by the way, that's very specific and very unique. Again, this is really about supporting organizations and community projects that are run by Black Canadians for Black Canadians, and of course have the opportunity to help support people who are struggling in this particular time.
Thank you. Minister, earlier on during these studies, we learned a lot about how the pandemic has shone light on the challenges in our healthcare system. And in particularly, we heard a lot about the information gaps and the data infrastructure challenges across Canada's health systems and how that limits our ability to monitor and to respond to COVID-19. I know that Health Canada has received $303.4 million of the Safe Restart agreements funding. So could you provide us with details on how this funding would help modernize and improve our public health and health information systems and close the gaps to help us fight this pandemic?
Thanks through the chair to the member for the question. No doubt about it, data has been a challenge during this pandemic. Obviously, provinces and territories have vastly different data systems and different ways of collecting data, different kinds of characteristics that they collect, huge gaps in, for example, racialized data and knowing exactly how the pandemic is affecting racialized groups depending on the province, territory, even sometimes local jurisdictions. And that has made it challenging at the federal level to truly have a concrete picture. And in fact, part of the Safe Restart Agreement, over $5 billion was for testing, contact tracing, and data systems that can give all levels of government a more granular understanding of how the pandemic is affecting the various groups that we have responsibility to deliver services to. I will just say that the Public Health Agency of Canada is working very closely with the provinces and territories now to get data on patients' ethnicity, to build out that data set, because we know from other jurisdictions and even from the limited data that we have that oftentimes various groups, racialized groups, are experiencing COVID-19 in worse ways than other folks.